Hi, my name is Dr. Stephanie Lamb, and I work here at Carnegie Women's Health. Today, I would love to talk to you about a topic called breast cancer. Breast cancer is definitely probably the number one cancer that will affect women all over the country. And it's a topic that obviously may be near and dear to many people's hearts because they most likely have had a family member affected by this disease. We here at Carnegie Women's Health obviously serve as your gynecologist, and we see women here every single day for routine checkups. And part of the routine checkup that we do here is a breast exam. That breast exam is a screening tool for us to help look for and identify breast cancer or lumps or bumps that may be precancerous. Part of what we do here at Carnegie, and when you come in for your annual checkup, is we do a full checkup. We will check your breasts. We'll do a detailed breast exam. And then we will order tests that are appropriate based upon your age. And part of those exams that we look for would be a mammography. Mammogram is a tool that can be used either for screening for breast cancer or if we find a lump on your exam to help diagnose breast cancer. Depending upon the age of the patient, and different guidelines for different organizations, but in general, most recommendations are for women to get their screening mammography at age 40. And, a little tricky, different organizations use different tools with regards to the mammography. Many women would be encouraged to get an ultrasound. So ultrasound is a tool that's used with a mammography, and it helps identify different textures of the breast. Mammographies are good to look for calcification and white and black areas of the breast, whereas an ultrasound may look to see more screening things such as cysts or solid tumors. So when we decide to order these screening tests, we will order a mammography and an ultrasound traditionally and send you to a really wonderful, reputable place to get your screening mammography and ultrasound performed. If, however, we do find a lump or a bump of your breast, majority of these are not cancerous, so you should not be overly concerned, but it's something that we want to follow up about. If we find a lump, then what we will decide to do is we will call the radiologist and we'll get you set up immediately for a diagnostic mammography and an ultrasound, and possibly even a biopsy if we think it's appropriate. Once you go for these tests, the results typically turnaround time will come back fairly quickly within 24 to 48 hours, if not immediately the day that you go in. We'll have an idea of what's going on. Like I said before, just because you find a lump or some little nodule of the breast, majority of these are not cancerous. So you should just take a deep breath, give us a call, and come on in for us to check you out. Once we check you, we're happy to order the tests that are appropriate and we'll get you seen immediately. If one of these tests do come back suspicious for cancer and we do biopsy you and the diagnosis does come back as breast cancer, the good news is that breast cancer is one of the most treatable and curable cancers that's out there. And the earlier that we identify it and the earlier that we find it, you really will do well. We will then set you up to see a breast oncologist or surgeon, and then the decision will be made for you to have surgery. And then depending upon where we are, based upon stage, and stage is how we look at breast cancer, there are 4 different stages. It will be decided whether you need just surgery or whether you need surgery and radiation. And depending upon the advanced stage, if you need surgery, radiation, and then chemotherapy. We will work with your surgeon and with your oncologist to create a team approach and help follow you throughout this entire situation. But in general, once again, if you feel like you find a lump or a bump, or even if you're here and we just happen to come upon something, we will get you set up for the appropriate tests. Average screening age for mammography here in this country, like we had talked about, is age 40. If you have a family history of breast cancer, or if a family member of yours has been screened for a breast cancer genetic carrier, such as BRCA1 or BRCA2, these are genetic terms, you may need your screening test done a little bit early. And so what we'll do is at the time of your general checkup, we'll look at your family history and we'll decide the most appropriate test and when we need to order those tests. And it may be a little bit earlier than 40. So once again, breast cancer, and the word cancer is always very scary to obviously say or hear, is very treatable. And the earlier that we can diagnose it and find it, the better you're going to be. So once again, thank you for being with me today, Dr. Stephanie Lamb. Come see us at Carnegie. Take care.